And I will share my screen. Okay. So this week we are transitioning topics. Last week we started and ended ADHD and externalizing problems. This week we're covering 2 chapters. So chapter 11 is about communication and learning disorders. Chapter 12 is about intellectual disabilities, which will include autism, I think. Well, no, I think that's next week, but for sure on chapter 12, it's intellectual disabilities. So I have it slated in the syllabus where we'll cover, I think definitely chapter 11, and we should cover most of chapter 12. Anything we don't cover this week, we might spill over into next week. Um, yeah, I can double just check the syllabus, but I think we should be covering both PowerPoints this week. No guest lectures this week. In terms of my own like research, clinical experience and interests, I do not have much experience with like clinically with communication and learning disorders. Um, I know of like one person in my cohort who is a child-based like neuropsych student, and I believe her interests fall along this like topic. I think it's a lot of like I think she looks at reading problems, maybe ADHD, but I think her lab does a lot of like dyslexia and dysgraphia. Um, how does like, yeah, how do those things impact like reading achievement and how do you do in school later on? So I think that is her area. I've not spoken to her in a while, but if there's any interest in hearing about that sort of like research side or what you can do clinically, let me know and I can see if she will be open to guest lecturing at the end of the semester. So we have like, I think like 3 or 4 class periods devoted to professional development, which can include other guest lectures. So if there's any interest, I can ask her. No promises that she'll say yes, but she's the only person I have in mind who does a lot of stuff in this area. So if there's any interest, let me know. Okay. So we are covering communication and learning disorders, chapter 11. Um, from what I can remember, what's on the exam, I will say I don't think there's a lot of stuff on like like the diagnostic criteria. I think it's a lot of like vignettes. Like if this person had illegible writing and this, and this, what would that person likely have as a diagnosis? And you would have to choose between reading or specific learning disability with writing impairment. So it's more of a case vignette style for this chapter. So don't pay too much attention to the diagnostic criteria, at least for the exam. So the way it's broken up is into communication disorders first and then learning disorders. So we'll start with communication disorders. So remember, communication disorders is all about speech. It has a lot of overlap with speech and language pathologists, or what people who are in speech language pathology school um, talk about, learn about. So keeping in mind that what we are talking about shares some overlap because of the um, remember, we're thinking about what's normative for language development, and abnormal child psychology takes into account normal to then talk about abnormal. So we are going to be thinking about normal development when it comes to developing speech and receptive language, which shares, again, overlap with speech language pathology. But where we're going to divert is where we're talking about, at least in DSM terms, like the psychology terms, the communication disorders that come out in this realm. So you might see overlap in terms of like language with speech and language pathology. Again, I'm not too familiar, so there I know there is overlap, but just keeping in mind that they're different domains. So something that might be called something here in the DSM world could be something that is commonly talked about in speech language pathology by another name. So there are going to be some terms probably that you've heard of and some that you may not have. Okay, so thinking about normative development, so language development, early language problems might be predictive of later communication and learning difficulties. That's not super surprising when we think about the normal developmental time span. We've talked about other disorders where really early prevalence or the onset coming on really early in life might be indicative of some more severe problems later in life. We've also talked about the opposite. It can appear and sometimes it can improve, and you can not meet criteria for a disorder by a later time in your development. With language, though, because it's so critical, early language problems can be predictive of those later problems. When we, again, thinking about normative development, there are basic components of language, which are all listed in the table below. So those basic components include phonology, morphology, syntax, semantics, and pragmatics. And all of those things theoretically should be mastered by anyone who uses oral and written language. So all of us are very fluent in speaking a language, and so we'll talk about English language. We all are familiar with phonology, morphology, syntax, semantics, and pragmatics. So phonology is the sound of language, and the rules for combining them. I think a lot about of like little like preschoolers or kindergartners when they're first learning to spell. We start with more phonology and how they sound out words. Morphology is the formation of words. It includes the prefixes and suffixes. Um, Syntax is where you start getting into the organization of certain words and phrases that has to do with your written language and how your actually your expressive language counts too, but it's how you're piecing together the words. Semantics is what the words mean, or if it's in a specific sequence. So if you see a sentence or a phrase, what does that mean? So that's the semantic. And the pragmatics is the using language in specific contexts. So knowing that some words are more appropriate for this context and it doesn't translate to another context, or maybe there are words that are translatable across all contexts. So there are a lot of components to language. And so there's a lot of room we can see for when we're thinking about abnormal development or when things go awry, how there can be components of these language domains that maybe don't get mastered or there are difficulties in. So we need to know the basic components of language, and then we also need to know the difference between receptive language versus expressive language. So receptive is comprehension of messages sent by others. So we're receiving sound and words. Expressive is production of language. So we are generating some sort of speech. We are sending messages to other people. So one is receiving messages. I have to hear your words. I have to listen. I have to understand your words. Expressive is I'm generating, I'm producing words to other people. So more about receptive and expressive. So receptive language is developmentally acquired earlier than expressive language. And if we think about that anecdotally, I think I've nearly always experienced that where I've seen someone understand the message first before producing expressive language. So you think about little babies who are maybe nonverbal, they're still babbling, but you can tell that the input makes a lot of sense. Like we know that they can hear us, they understand they can follow eye gaze. If you say something, we'll gaze. That indicates to me that there's some receptive language being developmentally acquired. Expressive language is the actual generation, so it makes sense to me that they're hearing, understanding language first, but the generation, which is babbling, but then later turns into full words, that tends to happen later on. So receptive language comes first, then expressive language. Um, we know that delays in developmental language milestones can occur, and they can exist in any component of language. So those 5 that we talked about on the previous slide, and they can exist in either receptive or expressive language or both. So there's that. And in terms of speech, like actually talking, understanding language, or both of them. And then I can't see you guys, children who fail to develop language or who show persistent or severe delays or developmental difficulties. Again, we need to decide what's normative, what's just a little bit of a delay and not a disorder, and is there any impairment happening for this child to be able to say it rises to the level of a disorder. But let's say all of those things are true, then we can say perhaps that this child who has failed to meet her milestones and has these severe difficulties and delays in speech or language, perhaps they then have a communication disorder. So thinking again still about impairment, but this one is pretty language dependent. It really depends on like what you would see a speech language pathologist diagnose. Just some examples of receptive versus expressive language at different developmental milestones. So, okay, I'm going to use this first example up here, birth to 3 months, receptive. Remember, we're receiving a message, we're hearing and understanding. I'm looking at this bottom one, seems to recognize caregiver's voice. So we know that there's some understanding happening there. Certainly, they're not generating language. They can't produce language at 1 day old, but there is some receptive understanding happening. Um, the expressive version of a child at birth or 3 months old is not necessarily speaking, like I said earlier, but more making cooing sounds. So maybe not babbling yet, but making noises, smiling at people. So I'm still expressing, like that is my form of communication at that age. Um, I like this table because I think we are always thinking in the context of development. So we know that things change based on the developmental stage, based on what age they're at. And so this is a good example of how things kind of build upon each other. And you can see that if there's um, some sort of like delay in something over here at 3 to 4 years old, it's pretty reasonable that that might cause some challenges at 4 to 5 years old, the next age up. Okay, so then that brings us to, right, so we talked about language development. What are the different components? What's expressive versus uh, receptive? Where are the areas of possible delay or challenges? Now we can think about what are the actual DSM diagnoses when it comes to communication disorders. So across the board, all of the communication disorders in the DSM share this one thing in common, which is that it has some sort of deficit in language, speech, and or communication. So that's what we talked about earlier. These are the five, yeah, 1, 2, 3, 4, 5 diagnoses in the DSM. We primarily are going to be talking about the ones in the bold color, so language disorder, speech disorder, and social/pragmatic communication disorder. Um, that's not to say the other ones aren't important. I just don't think we have enough time to cover all of it. So the bold is the one that we'll be focusing on. And this is a note at the bottom that I mentioned at the beginning of class. So terms to describe communication impairments have changed over time, and they may be different among different professions, whether it's, again, speech pathology or us or a medical provider. So developmental dysphagia, specific language impairment, language disorder can all be related to one another in different domains. Okay, so first one. Remember up here, bolded language disorder. So that's what we're going to start with, language disorder right here. Okay, so language disorder has to do with difficulties in acquiring or using language due to impairments in comprehending, so receptive, or producing vocabulary, sentence, or discourse. So comprehending is a receptive impairment, and producing language would be an expressive language impairment. So remember, I'm not listing out the specific criteria in terms of A, B, C, D, but we know that if we're going to give someone a diagnosis of language disorder, these problems cannot be due to sensory or motor problems, any other medical or neurological condition, or some other like intellectual disability or global developmental delay. So in the DSM, whether you look at something in like the OCD or the ADHD or the language disorder, there's always going to be some sort of criterion that asks you like, are you sure it's this disorder? Are you sure it's not explained better by some medical condition, some sensory problem, or some other like intellectual disability? There's always going to be a criterion because we need to make sure we're doing differential diagnosis. So not a surprise here that there's some sort of criterion saying, make sure it's not due to some other sensory problem or what have you. In terms of onset, so when does the like symptom cluster first appear, or when does the problem first appear? We think that the symptom onset must occur during early development, again, which makes sense when we go back to that table of what you need to have done from birth all the way up to 5 years old. You can see that like a delay or deficit earlier on is probably going to impact something later on in life. So it makes sense that the symptom onset must occur during early development. And when we think about the 4 Ds, so deviation, developmentally inappropriate, and so on, we always talk about what is it appropriate to the age. Here it needs to tell us that abilities must be below the expected age for that child. So I'm not saying you have a language disorder if this is a 5-year-old I'm assessing and they can't speak at the level of a 16-year-old, right? That's not developmentally expected. That's not what we're saying. Are these abilities below what we would expect for a 5-year-old of all 5-year-olds in this case? And then always some sort of limitation. So remember, negative functioning or some sort of impairment. So these language disorder limitations must interfere with communication, social participation, and academic or occupational achievement. So it's when you just think about it, it's no surprise that you're probably going to have some sort of academic achievement issues if you're having some issues in language disorder. We rely on language to speak, to write, to understand. And so if you're in a class setting, having a language disorder is probably going to be associated with some sort of challenges, at least in academic achievement. So that one's a pretty obvious one. The other thing that I think is not always obvious to some people, but we think about it, especially in terms of little kids or school age kids, not having a great understanding because you have some sort of developmental or language disorder can definitely impact your social participation. Not being able to understand, let's say, like receptive language, having severe deficits in receptive language is certainly going to impact, can they understand what other kids are saying when they're, let's say they're playing a game and there's rules, a kid's reading out the rules of the game. Not having receptive language would impact their capacity to be able to engage in that game. And maybe that impacts self-esteem. Maybe kids are not very nice and they start bullying the kids. So that's really going to impact social participation. So I know it's a communication disorder, but think about the impact that it would have on the day-to-day life of a kid. Okay, so that's just the general, what are the things we're looking for? But the primary thing is language impairment in comprehending or producing vocabulary. So when we are talking about expression problems, so impairments in producing language or talking, this includes things like limited amount of speech or speaking in extremely short, simple sentences. Their vocab might be really small. You might find that in a sentence sequence, some of the critical words are missing. So it's almost like there are gaps. Like you can imagine, I don't know, like the dog ran far, the dog far, right? Like missing that ran might be an example of expression problems. Unusual word order may be displayed. So I just gave that example of the dog ran far. So mixing up some of the order, like the far ran dog, like that might be an unusual word order. And then making errors and making word forms. So this also, remember, always needs to be developmentally appropriate. It's not that uncommon for kids to get like past tense wrong. So rather than I went to the store, they might say I goed to the store. Um, I ran outside, I runned outside, right? Because they're familiar with putting the ed as the past tense to the word form. That's pretty common and that's developmentally appropriate up to a certain point. If you're still making these errors in word forms and you're exhibiting some of these other things and all this impairment that we just talked about, that might be more indicative of a language disorder. So it looks like that, like the plurals and the verb tense might be messed up, but it's not appropriate for this age range. Okay, and then we have receptive problems. So these are impairments in understanding, comprehending. So this is problems with single words, phrases, sentences, multiple meaning of words, etc. So any language form is going to be pretty hard. And the way that that might be indicative or indicated, so you may not know that this person has expressed receptive problems because it's the comprehending part. It's not the generating language. But how you might notice it is by noticing that they're not responding to speech. So there's some sort of delay and you said something to them and there's not really a response back. This third point, they may seem deaf. That could just be they didn't understand what you just said. There was some sort of processing issue. Or they may respond inappropriately to other speech. So that's a clear mismatch of what they thought they heard or what they understood is not actually aligned with what you did say and what would yield an appropriate response back from them. Okay, so that's language disorder. It's a pretty broad, like, remember, it can be expressive or receptive problems, but it's any impairment issue in those two domains. That's different from a speech sound disorder or SSD, and this is difficulties in speech sound production or in articulating speech sounds. So this is really about, and I can see where this would use a lot of intervention in a speech pathology context where they're really helping form articulation. How are you saying the words? Do you have a stutter? Do you have, like, can you not articulate the word? Are you using like a W sound still to talk about an R sound? So that's really need for intervention for the speech production itself. So speech sound disorder kind of already sounds like we're having issues in production of speech, right? So expressive language. If we're thinking about difficulties in speech sound production and articulating speech sounds. As always, needs to be developmentally inappropriate if we're going to consider a speech sound disorder diagnosis. So in this context, the child must fail to display appropriate and dialect appropriate speech. And that this sort of impairment or this delay is what's going to interfere with their ability to be understood or communicated with by others. So we think about the impact of having a speech sound disorder diagnosis. One of those consequences is that you are not as understandable to other people. If I can't articulate the words that I'm saying, if I'm taking some words and like the sounds are getting blended, it's pretty hard for somebody else to have their own receptive language of what you just said. So that's, you can see or imagine like the impact of that on others and how that would impact social participation, even like occupational achievement, things like that. Excuse me. Again, always developmentally appropriate. So they need to be in relation to the developmental norms. So like thinking of the word like rabbit, RABBIT, when there's a child at a certain age range, it's not uncommon to hear wabbit with a W, right? That's a speech sound articulation issue between an R and a W. That among like 3-year-olds, right? I think I'm just making that up, but let's say that's a norm for that age range. Yeah, it's pretty common to hear the R and W mixed up. I'm expecting that for the 3 to 4-year-old, not the 15-year-old, right? Let's assuming English is the first language, assuming all other things are intact. That's not something I would expect a 15-year-old to still struggle with. And so in that situation, that's indicative to me that, ooh, we're kind of bordering on a speech sound disorder. Like the other one, symptom onset must occur during early development, needs to be below the expected age range for that person, and we need to have all these impairments. So what this looks like in terms of like examples of speech sound disorder, so you might hear incorrect speech sounds. They might substitute easily made sounds for more difficult ones. So if you have like, maybe there's like a vowel that's really hard to pronounce for this person, like kind of not necessarily intentionally, but like finding another vowel or another consonant to replace it in order to say the word is another example of that. So I think of rabbit and wabbit. It's easier for maybe the person with speech sound articulation problems to do the W other than articulating the R. They might even just omit the sound and say abbot. And they may correctly produce a speech sound in one context, but not another. So it doesn't have to be the same across context, but that in and of itself is a little bit interesting if you're noticing, oh, they can't say a word in this context, but then can do it in this context. That might be indicative of some other issue. Okay, so this is DLD, which remember, we go back, there's a lot of different ways of labeling a disorder based on the discipline. So DLD, I believe, is developmental language disorder, which is this top one, language disorder. Remember, so it's expressive or receptive. Basically. So we are going to, oh, can you hear me? Okay, we're going to play a sound and listen to what this would be like in the context of teens. And hopefully you can hear the sound being shared, so tell me if you can't.
So this year, on the 19th of October, it is Developmental Language Disorder, or DLD for short, Awareness Day. This is a new diagnostic term that's going to be used to describe children and young people with speech and language difficulties. Language and communication skills underpin absolutely everything that we do, not just our ability to express our needs and thoughts, but also to access education, socialize with others, and to make friendships. Language and communication skills are something that many of us take for granted, so it's really difficult to understand just how much having a language impairment can affect a person's life. I work as a specialist speech and language therapist at Morehouse School and College, which is an outstanding specialist school for children and young people diagnosed with language difficulties. I work with students individually, in groups, and in the classroom, where we focus on learning new skills and developing strategies to support communication through the use of specialist systems. DLD is actually very common and it affects approximately 2 children per classroom. However, many people who work in education have never heard of the term or fully understand what it means. That's why this year our goal is to raise awareness of DLD through sharing the experiences of our young people and explaining how speech and language therapists can support these students.
It's a certain disorder of when people have trouble understanding and it affects their talking, their language, and just the ability to understand others.
It kind of feels like you're in a different world and you don't belong anywhere.
At first, you don't feel like you have anything wrong with you until you start doing work, and then you clearly see there's something there. DoD feels like it. I feel like I have to explain myself, and I find it really difficult explaining myself sometimes. But yeah, I think it is invisible because people don't see it. Like, it's not a visible thing. It's not something that's like tattooed on your skin or visible like in my features. It's something that's mentally in my brain that I can't process as fast or as clearly as other people can.
Students with DLD also have something called word finding difficulty.
How does it feel when
Okay.
you've got
That one is not okay. So that one is just an example of like what is the impact. I've talked a lot about that. What do we think the negative impairment is on others? And again, because this is the child class, I talked a lot about this in the context of younger kids, like school age, going to like third grade, fourth grade, fifth grade. But this is without intervention, right? This is how you talk. This is how you understand things. So this is going to be a lifelong thing without intervention. So understanding the impact on teenagers. And then there are also college students on there, the Morehouse college students. I thought that was interesting to hear one of the guys talk about like it's invisible, right? It's not like a feature that I have. It's not like I exhibit like for instance, Down syndrome, like has very very like features that are very common across people diagnosed with right anyone with Down syndrome. So he's saying it's not one of those things where you can tell, but it's like as soon as something starts coming out of my mouth, like there's some sort of obvious discrepancy between what I'm saying or what they're saying or how I understand something versus how someone else understands something. And the impact of that is that things don't make sense. Like I'm struggling in school or it can be very lonely. It feels very socially isolating to have this experience in a different way. So I like that one for talking about the impact of having a language disorder in the context of older kids and up to college students. Okay. Also, the full thing is linked on Canvas if you did want to watch the rest. Okay, so that was language disorder. Remember, just any deficit in either producing or generating sound or receiving, so hearing or comprehending. This is an example of speech sound disorder. So our DSM says SSD. In other disciplines like speech language pathology, you might hear articulation disorder. So those are one and the same. Here's a little girl where you can kind of hear some articulation issues in the way she says certain consonants and vowels.
Hi, my name is Grace, and my favorite movie is SpongeBob SquarePants, and I like my dog Lou. I have lots of friends, and one of my best friends are Courtney. And I really want to be a vet when I grow up, and I like the LP, and I like a lot of stuff because it's of so many. But I guess everything's good. So yeah, I guess everything's really good because I love my life. I love my friends, and sisters, and all my friends, and love friends. And I just love everything that's part of my life. And I guess I like going and Lord going, and I like all my friends because they have lots of friends. And I hope no one gets to choose because I just and I go to school and I like lots and lots of stuff. And and today we're going to do a speech and we're going to do lots and lots and lots and lots and lots of stuff. So I hope you enjoyed the video.
Okay, did anyone, I know it's kind of quiet, but did anyone hear any like sounds that maybe she struggled with?
Yeah, I heard that she was stuttering a lot when she was trying to talk, like she would pause a lot.
Yeah, stuttering. Yeah, so would stuttering fall under expression problem? Yeah, so you're kind of having an impairment in expressing or generating language, so that would be some sort of expressive problem, and this falls within the speech sound disorder diagnosis in particular because there are some issues in articulation. Um, I think the stuttering definitely was there. I feel like that one didn't stand out to me as much as hearing some issues in, I think it was the example I gave earlier. The R was really hard for her. So my twins are going here. Um, she said a couple other things like, so one time she said like, and the L was hard for her, but then she said it again in a different sentence, but she was able to say it right. And I think that probably because it followed whatever the preceding word was, made it harder or difficult for her to say the L, but it sounded like she had some issues with saying L, but definitely the R versus W issue. And keeping in mind, like, yes, yeah, lots is, yeah. So R and friends, exactly. The other thing I was going to say too is she's little, right? Like, I think I don't know, maybe 5 years old, if that. But so we're already expecting some, it's like it's common to see some like errors occasionally, right? Some mispronunciations, that's pretty to be expected. But it was pretty clear that we were hearing the L versus R versus W issue kind of. We could hear it basically. Even hearing a very quiet video, it kind of stood out to us, which tells us that that still wouldn't be aligned with what most children that age probably can say and how they're saying it. So potentially a point of intervention for speech language pathology. And I think very common too. Like I think taking the DSM stuff aside, like again, I'm not a speech language pathologist. I have a friend who's a speech language pathologist. And actually my little brother, I forget all the time because this was when he was like 3, 4 years old, learning how to speak. He's now 18, right? Speaks quite normally, has no issues in pronunciation and articulation, no issues in receptive or expressive language. So I think this is one that I find like this section of disorders I find really like especially positive because you can see with intervention, it really does help and you may no longer meet criteria. So having articulation problems at age 5 without intervention, yeah, you're probably going to continue having articulation problems, but with intervention, can really turn things around, which I think is really nice. Okay. Any last thoughts about the video before I move on? Okay. All right. Go back. Okay, so we saw two video example, or we saw the articulation disorder example. We did not see a DLD example. We talked mostly about impairment and what the impact is on the person. But some examples that you might look for a language disorder are having short, immature sentences, like leaving word endings off. So instead of saying I have two shoes, saying I have two shoe. The incorrect form. So I gave this example already, like me like ice cream, he goed home instead of he went home. When you see like certain words are missing, or they can't find the right word to actually, like they can't place the word that they're trying to say. So this last bullet for lunch I had, the spiky thing, yellow inside. So don't know what he was saying. Well, I don't know, he's probably asking for some fruit, but not being able to place it. And let's assume that this is pretty like common household language. Like let's say he was talking about a sponge, or maybe he was talking about like a lemon or something. Let's say it's something that is common household knowledge, pretty well talked about, like very common. So we say that that's the type of thing that would be hard to find the word you're looking for. I wouldn't necessarily say like some really niche word that no one knows about, like that counts. Like I don't think that counts because that is something that I probably wouldn't be able to place the word either. So it needs to be something that like they see it right in front of them, or they just saw it, or we all know what that thing is and they're still having trouble finding the word that they're wanting to say. So again, language problems with expression. Problems with reception would be in a classroom context, not following instructions, especially with sequencing of time. So yesterday, after a week, and space. So saying something like, okay, first, push in your chair, then put your jacket on under the desk or something like that. Like that sequence of time. So first, then, and then the preposition of underneath, above. So in this case, putting your jacket underneath the table, first pushing your chair in. So those are basic, right, two-step commands that you might see some issues following with other problems. Let's say it could be externalizing. Let's say it's like ADHD or ODD. Yes, you could see problems in this exact same example, but what we're really looking for here is that there seemed to be some sort of comprehension issue. It's really about the understanding of the instruction that got garbled versus with a conduct problem, maybe it's more intentional, like I'm trying to be defiant, or with ADHD, maybe I'm just clumsy, or like, my body's moving. So it's that this example can be used across different disorders, but the way this one stands out is that there's something in the processing that seemed to go awry. Okay, and then the SSD, we just saw a little video of that girl with rabbit and wabbit, so that R and W getting mixed up. Wello instead of yellow, brown instead of brown, dis instead of this. So just kind of two letters. It could be a consonant, it could be a pair of letters that are tricky. You'll notice it when you hear it. Okay, so there was one other DSM disorder specific to speech, and I think that was childhood, like fluency onset, something like that. We're not covering that. I actually don't even think it's in your textbook. I'm not too familiar with it, but you can look it up if you're interested. But there's another disorder specific to speech. The one that I do want to talk about is social pragmatic communication disorder. And the reason I want to talk about this is because if it's not later this week, it's going to be next week. We'll also talk about autism. And there's a lot of speculation and conversation about the difference between social pragmatic communication disorder and autism. I've also worked with a little girl who was she was 6 and then she turned 7 by the time we were done working together. Family kind of suspected autism, but it wasn't very pronounced. And I think she's an example of what you think of when you hear that girls have a different presentation and lower diagnosis rate of autism than boys of that age. And even the parent had asked, I don't because of all of this, I don't think it's autism, but do you think it could be social pragmatic communication disorder? And so that was actually my first time hearing and talking about that in a clinical setting. And so I can bring in that case too, if it's helpful to talk about, but just keep this one in mind. A lot of times people talk about autism and how that differs from this communication disorder. So we'll talk about the communication disorder first and then save autism for next week. Okay, so what is it? It's a persistent difficulty with verbal and nonverbal communication that cannot be explained by low cognitive ability. So it can't be explained by low IQ, having an intellectual disability. This is specifically related to difficulty with verbal and nonverbal communication. What that might look like is difficulty in the acquisition and use of spoken and written language, or problems with inappropriate responses in conversation. Like all the other ones, symptoms need to be present in early childhood, needs to be not on par with their developmental abilities and what you would expect for their age. and again, needs to have negative impairment. So some sort of impact on social relationships, academic achievement, communication, what have you. There is diagnostic overlap with autism, so ASD, autism spectrum disorder. And I think the thing to keep in mind is that while ASD does encompass this sort of communication like aspect, so there's a social communication criterion of autism that you have to meet criteria for. And again, we'll talk about it next week. That's the only overlap it really shares with social pragmatic communication disorder. It's just that one domain of ASD. But ASD also includes another criterion B, which is that you have to meet criteria for having restricted repetitive behaviors, interests, or activities. And so social pragmatic disorder wouldn't necessarily share that overlap of the repetitive, the RRBs. So with ASD, we see it as more all-encompassing. It has both aspects, and they're weighed pretty heavily, like pretty equally with one another. The social deficits are about as impairing theoretically as the RRBs perhaps are. Whereas social pragmatic disorder, the primary lens that we're looking at is just the social deficit. There's something happening in the verbal and nonverbal communication, comprehension and generation that's impacting the child. And you wouldn't necessarily see repetitive, so RRBs, unless, and even then it wouldn't be an RRB, it might be like trichotillomania. So you might see, oh, I am seeing some sort of like behavior that I think is repetitive. It could be a kid has skin pickings, excoriation. It could be hair pulling, could be one thing, which would be trichotillomania. So that is possible that you could have some of these things. They might have some pretty like low number of activities and interests, but it may not necessarily rise to the level of autism. So there's a lot of communication or discussion about this disorder versus ASD. And I think the clearest distinction is that autism has to have both of these criteria, the social communication domain and the RRBs. Social pragmatic does not have that. It's really just about the communication part. And I think another thing to remember is it's the communication. It's about expressive and receptive language, that there's something going awry in that like the processing speed or whatever it is, like there's something happening in the way that there's speech being generated and received. We think of autism as having these also social communication deficits, but I think the way it's talked about usually is more in like a social context, like, oh, there is a response made that doesn't really seem appropriate for that conversation. That's similar to this bullet point up here, problems with inappropriate responses in conversation. That's why you kind of see some similarities. But again, the distinction seems to be that there's this RRB component. Yeah, so here's a paper that I pulled. It's a review article, and pretty easy to read because it's a narrative review, and it's asking, are they two of a kind, or are they one and the same? And here, I think at the conclusion paragraph, or actually, I think this was from the abstract, I pulled it, and it says there is overlap in the diagnostic criteria of SPCD, so social pragmatic communication disorder, and ASD. What is that overlap? It's precisely the problems with social communication. However, it seems that the presence of restricted and/or repetitive interest and behaviors, so RRBs, is crucial in differential diagnosis between the disorders. So you have to be able to rule out social pragmatic communication disorder in order to even give a diagnosis of autism. So you have to have this additional qualifier as part of it. So if you don't have RRBs, it might be more indicative of an SPCD diagnosis. If you do have RRBs and evidence points to it, then you are likely giving an ASD diagnosis. Okay, prevalence rates, quite well, 3% is pretty low in the general population, 7% is also pretty low. We do tend to see higher rates of diagnosis for boys than girls. Across the board, whenever we see this gender difference, we're always going to keep in mind there's some referral bias. So a lot of times externalizing problems get kids referred to treatment earlier than internalizing. Historically, we tend to see boys come in with externalizing problems earlier on and more frequently, and then girls tend to come in for more internalizing problems a little bit later on, but it's more noticeable. So that does have to do with referral bias, and there's some evidence that it could be that gender difference really does exist. SES, we're always going to see this as well. Typically, you see This is actually the opposite of what we would expect, but most of the time we see lower socioeconomic status being associated with, or being more strongly associated with some of the other mental health disorders, so like conduct disorder, ADHD, what have you. In this group, we're saying that we have higher rates for children, same thing, higher rates for children with lower socioeconomic groups. So same correlation that we would expect. Lower your SES associated with more, it could be mental health, but also communication based problems. A lot of different reasons. So we always have to keep in mind the genetics realm, the like neurobiology, the environment. So that environment includes parenting, the SES itself, so which includes community, all things like that. So all of these different things have been used to discuss why perhaps we see this association. Okay. Let me just double check where we're at. Yeah, okay. Okay, so we talked about developmental course, and one of the things we talked about earlier on is that the presence of communication problems early on can be indicative of more severe language problems later on in life. So if we think that, then let's talk about the developmental course. How does it actually wax and wane throughout time? What should we expect at different time frames? So we expect that language disorders appear by age 3 or 4. More mild difficulties might be identified later on, let's say 5, 6 years old when they're still in schools. That would be kindergarten, first grade. But we tend to see these disorders appear by age 3 or 4 because that's when we're starting to speak. That's when you start noticing this discrepancy between what we should expect and what we're hearing or what we're seeing. Impairments may become first apparent. Impairments may become first apparent with demands of schoolwork and greater complexity of language. So again, entering the school age years is almost always going to be one of the first like signs that something is happening for a kid. So we often see it for ADHD. It's pretty clear sometimes at home that maybe your kid is not following directions, but it seems like, oh, well, we just don't have structure. Putting them in school tends to be that first sign, and they get referred to treatment to decide, is this person have ADHD? Do we need to treat them? So just as that would be the same for ADHD or conduct problems, it's pretty common for language disorders also to be first noticed really in schoolwork. So again, remember, a teacher probably has more variability in their mind, has more experience with multiple kids of that age range, has some sort of sense of what's developmentally normative for this particular age range. So with that in mind, putting your child in school and that teacher may be noticing, ooh, this is really not on par with what I know 98% of my students at this age say, or how they receive language looks like, that could be, again, indicative of some language disorder. So school tends to be one of like a really, really important place for at least that first screening question about any of the mental health problems. As we talked about, I used the example of my brother. He was like 3, I think, 3 or 4, when we had like, okay, I think it was like 1 time per week, like practicing with like a lollipop, like articulation of words. So moving your tongue in certain directions because that helps with articulation. Having intervention at one point in time can really improve drastically your outcome later on. You may have no problems, or you may still have some problems. It might come out in small ways, but for the most part, you can see improvement over time, and your language abilities can come back to normal. So you can meet the developmentally normative range that everyone else is at. So again, the example of my brother, you would have no idea ever that he had speech therapy at like 4 years old for like 6 months. So again, it can improve and really stabilize out with your peers. That's at least with speaking, with language abilities. But problems in spoken language and reading can persist. So my brother was the example of speaking, who actually did quite well. But again, if you don't have intervention, you can continue to have issues across time with your spoken language and your reading. There's a little hierarchy of risk for later language impairments. So the lowest risk is for articulation problems only. So across time, articulation problems tend to have the better outcome. So that's, I think, probably the closest example to my brother is mainly articulation. Expressive problems tend to be in the middle, so you kind of maybe somewhere in the middle, like as you grow out of it, maybe, or once you get with treatment, you might meet normal range, but you may not. Receptive problems, so really that's that comprehension, understanding, that's the thing that has the highest risk for later language impairments. So really not being able to understand or hear language and the way that it was intended, to understand the context in which it was generated and given to you, that's the thing that's going to have the highest risk of later language impairments, which is not surprising. So one is like really understanding, comprehending. The lowest risk is I understand and I can speak, I'm just having some articulation problems. I need to better enunciate my words, or I'm having particular problems with one vowel or one consonant. So that seems to be a lot more manageable and lowest risk compared to I'm having full comprehension problems. Again, speech problems often remit over time and are responsive to intervention, which is why speech language pathology is a whole discipline. It's a whole career. It's why it's very closely associated with schools. And so that's because we can have intervention and people are very responsive to intervention. I'm going to skip these parts, but in red, that is important. It comes up on the exam, I think. Co-occurring disorders. So again, always take this with a grain of salt whenever we have co-occurring disorders up here. These are the ones that tend to cluster together. So there's high comorbidity between this disorder and another disorder, or maybe multiple. So this is what we typically see, but keep in mind, this is also kind of inflated by the categorical model of psychopathology. If you have to meet criteria for only one disorder and you meet the exact same criteria for another disorder, it's a no-brainer that you're going to meet criteria for multiple disorders. So always take it with a grain of salt. It's kind of an inflation that happens with the categorical model. But in practice, yes, this is what we typically see clustered together. So we usually see someone with like articulation problems also have perhaps a learning disorder, which is also a separate classification of disorders in the DSM, but are closely related. And when we think about the academic achievement consequences, perhaps, of having receptive language problem, it makes a lot of sense that you might have some poor academic progress, and that being associated with a learning disorder kind of tanks you even more. And then externalizing and internalizing problems, I think that's across the board for nearly all disorders. If you were to think about it, though, I'm especially thinking about internalizing. I can imagine having a language deficit, not being able to speak properly or understand things properly. I can see that causing anxiety or depression within a child, and that giving rise to some more internalizing problems. Okay, these are some of the theories in your textbook about how this kind of develops over time. So there's different models. There's information processing capacity model, a whole bunch of these. It's only a page and a half. I would read it if I were you. Not going to cover it in the text or in the lecture, though. Okay, how are we doing on time? Perfect. This is actually a really good place to stop. So we got through all the communication disorders. Wednesday, that means we'll cover the learning disorders, and I think we'll be able to finish it. And then we can talk about the intellectual disabilities after that. Okay, I'm gonna stop sharing. Any questions about what we just talked about? No. Okay. Yeah, I think it's pretty straightforward. I wish I had more case vignettes for you guys. It's just kind of hard without having personal experience in certain areas. So again, that's why I asked Shira to speak on conduct problems, because that really is not my area of interest and also not what I have clinical experience with. So if I can think of any, I have that one case that really was an autism case, but there was a diagnostic question of social pragmatic disorder. I can weave that in next week. But really, I think most of the case vignettes will come in the week after. So like eating disorders, internalizing problems. So I've had a lot of more experience with depression, anxiety, autism, social anxiety. PTSD and personality disorders. So that's where really the case vignettes are really jam-packed. But I can think if I'll ask around if people have any cases that they would like to share, especially for this stuff, because I don't have a lot to share with learning disorders or communication. But okay. All right. I'll let you guys go and I'll see you guys on Wednesday. And if you're sticking around for office hours, I'll be on the other link. Thank you.
Professor, I just
Yes.
wanted to let you know something. I'm actually
Sure.
having surgery next week on Thursday. So I will come Monday and Wednesday, but it's a possibility that the following week I might not be in class.
Okay.
Possibly. Now, if I feel better and I feel good, I'm popping in.
course.
It's fine. It's online, but just giving you a heads up.
Yeah. Do you mind just sending me that so I make sure that I have you in my mind that you're not missing? Like, I'll let you know what you miss if there's anything you are missing. But yeah, just shoot me an email so I have the dates in my mind. But I hope it goes well. I hope it's
Thank you.
an easy recovery. Yeah.
Thank you. Appreciate it. Yeah, for sure.
Okay.
I'll let you know. Bye, Grace.
All right. Thank you.
Okay, thank you. Bye.
Bye. Okay. If there are any questions, I'm going to jump to the other link, my office hours link, which has already started. So, or if you just need to ask a question, send it to me on Canvas. Okay. All right. Bye, everyone. Let me stop sharing.